In other news, the Kaiser Family Foundation released a study in September of last year. They found there is a shortage of psychiatrists in both Missouri and Illinois. They also found many people need help dealing with this pandemic. So let's talk to Dr. Dixie Meyer. She is a licensed mental health counselor for SLU Care. Thank you so much for joining us today. Dr. Meyer, can you hear us?
Can you hear me?
I can hear you. Thank you so much for joining us. I'm going to ask you, has it been harder from your perspective for people to get appointments for different types of mental health care since the pandemic started?
Absolutely. There are a lot of people that are really struggling to try to find mental health services at this time. And people are really needing to seek out counseling in unconventional ways. They may be going to their churches for help. But there are a couple of places that people may not be thinking about. So, for example, at SLU Care, we have integrated care at our primary care settings. So individuals that are going in for a regular checkup can actually meet with a therapist there. And individuals might want to be checking places like the United Way, which has a list of community organizations there to help you and meet your needs. Places like your insurance will have a list of providers for counseling for you. And we will also see other places that offer counseling services that are pretty unconventional. For example, at universities, they often have community counseling centers. Like at St. Louis University, we have the Center for Counseling and Family Therapy, and we offer counseling for the community on a sliding scale.
So from your perspective also, what barriers are people facing?
So I think we're doing a pretty good job about talking about the challenges that are out there. We're talking about the public health crisis. We're talking about the food insecurity, job stability concerns, but we're really not talking about some of the bigger issues some of the other issues that are affecting people. So we are seeing families that are really struggling with some of the day-to-day things. So in my research lab, we're actually running a study where we're following families and just learning about their experiences throughout the pandemic. And we're finding that a lot of families are reporting distress. They're saying things like just the fact that everything they do and try to do is more difficult and more dangerous is a big challenge for them. We're finding that the fear of contracting the virus, the fear of their loved ones contracting the virus, all of these little things that just coincide with living through a pandemic is really taking a toll on individuals and their mental health.
Well, are certain people having more trouble than others getting care? And if so, why do you think that is?
Well, there are a lot of disparities when it comes to healthcare. And, some of the ideas of places where you can seek out counseling, you can get it from your insurance. Well, not everyone has insurance. You can get it from an employee health program, but a lot of people may not have an EAP or may not be currently employed. So when we see these disparities that are present, it really then becomes up to communities that help really nurture one another and for us to really lend out our support to our loved ones to make sure that they're getting the help that they need during this time.
This is the time for us to network so we can all get through this. We will have a link for more information on fox2now.com. Dr. Dixie Meyer, thank you so much for your help this morning. We appreciate it.
Thank you.